If a single point on your body could decide whether tonight you keep your rhythm or run out of breath, would you dare to ignore it? If exactly 1 minute of gentle touch could draw blood flow and calm back in, would you want to try it tonight? And if long silence has shaken your confidence, isn't it worth taking back the wheel with science, not rumors? I'm Dr. Emily Carter, a urologist in Austin, Texas. This is Men's Health Secrets. On this channel, we talk about men's health in a calm, respectful, and practical voice. No miracles, only small steps you can measure. In the next few minutes, I'll show you the forgotten point in the pelvic floor, the hub that coordinates blood flow and staying power, why it so often gets locked after 50, and how to unlock it discreetly, safely, and without embarrassment. By the end of the video, you'll have a 1-minute ritual to do tonight and a single question for tomorrow morning to measure how your body differs from yesterday. If you feel you need a kind and effective approach, subscribe so you don't miss what's next. If this opening speaks to your concern, leave a gentle number 1. If it doesn't quite fit, leave a 0 and add the word stuck so I can read and adjust in the next video. No one is forced to do anything here. The choice always belongs to you and your partner. Before we practice, we need to call the forgotten point by its right name and understand why just 1 minute done correctly can change an entire evening. Begin part 1, naming and resetting the ground, what the perineum is and what it is not. Between the scrotum and the anus is a flat area about the size of a coin called the perineum. It isn't a magic button, but a muscular, vascular, neural base that supports the prostate and sets the rhythm for pelvic blood flow. When we sit for long periods, hold our breath from stress, or hunch over a screen, this muscle group tightens like a handbrake that's been pulled and won't release. Blood slows, and sensation and stamina slow with it. Picture an old house that's still sturdy with only the pipes rusted. You don't need to knock down walls, you just need to open the valve to let the warm flow return. What matters is that contact with this area should always be light, brief, non-invasive, and without heavy pressure. The goal is to release the brake, not to activate in it. Do you notice some nights you hold your breath more than you exhale, and some mornings your hands and feet are colder than usual? Those very small signals are the map that tells us where to begin. Age doesn't take away masculinity. Sedentary habits do. Hours on a chair each day, few steps, plus the habit of holding urine or sitting with one hip tilted make the pelvic floor bear the load for too long. Stress shifts the body into alert mode, the breath rises into the chest, the belly barely moves. The sympathetic nervous system takes the wheel, leaving the pelvic. Muscles taut like a tightened string. When you enter a private moment, the body hasn't had time to return to a calm rhythm. Suddenly you feel hurried, short of breath, prone to speeding. If you can identify this root cause, you'll understand why just 1 minute of releasing in the right place can move an entire night toward a slower, deeper, less startle-prone rhythm. Question for you. What in your day is tightening your pelvic floor the most? The chair, the worry, or the habit of suppressing sensation? Tonight, before you turn off the light, wash your hands, warm your palms, sit back comfortably, let your shoulders release, and gently close your mouth so the tongue rests on the soft palate. Place one hand beneath the scrotum to orient yourself. With the other hand, touch very lightly the flat area between the scrotum and the anus. Trace just a tiny fingertip-sized circle while keeping a slow 4-phase belly breath. Inhale, pause for a beat, exhale long, pause for a beat. Do not press deep. Do not chase intense sensation. Do not test your pain threshold. If you feel discomfort, stop immediately. 1 minute is enough for the first night because the goal is to remind the body to release the brake, not to hit the gas. If you have soreness, bleeding, fever, a urinary tract infection, have just had a dental procedure, or have a complex prostate diagnosis, postpone the ritual and talk with your doctor first. At this point, keep an open loop. This ritual doesn't promise miracles. It's a small signal sent into a tired system so that tomorrow morning we can see how it answers. Are you ready to hear your body's reply? As soon as you wake, before picking up your phone, write one line. Are your hands warmer? Is there less tension below the navel? Is the first urine stream of the day round and even? Is your mind less rushed? Just 10 seconds, and those 4 signs are enough to draw a trend line across 14 mornings. 1 off night says nothing. 7 steady nights say a lot. If after 3 consecutive nights you notice warmer hands and less lower abdominal tightness, that's the time to add 1 longer exhale to the evening ritual. If it feels just the same, don't conclude too quickly. Recheck your chair, posture, and walking time during the day because the pelvic floor is influenced by the whole day of living, not only 1 minute before sleep. The turning point isn't when everything suddenly feels 20 again, but when you realize you have the right to slow down and still stay present. A dramatic yet fair warning for everyone. Trust cannot replace testing. 1 minute of touch can be a tonic when the body is ready. It can also be a mistake if you push on shots during a day when the mucosa is irritated or when unusual symptoms appear. Let one sentence stand guard at the door. Stopping at the right time is moving forward. Book a medical visit if you have acute pain, burning with urination, blood in the semen, fever, or unexplained weight loss. Once it's safe, we return to the slower rhythm. Do you want to sprint or reach the finish with the person you love? Stamina doesn't come from pressure. It comes from steady blood flow and a nervous system that isn't in panic. Before intimacy, stand and walk slowly for 2 minutes to warm the hips. Take 5 belly breaths to bring the sympathetic brake back to neutral. Then begin at a pace 1 notch slower than your habit. When you feel the body rushing, shift your weight and switch to a lighter touch so the pelvic muscles have a chance to breathe. If one hip gets tired, change sides before the body sends a panic signal. Tonight's goal isn't to prove anything, it's to keep a dialogue with the body where no one has to shout. If this section eased your tension, leave a 1 and you're city. If you're still stuck, leave a 0 with the word stuck, and I'll respond in the next video. In the next part, I'll show you how to pair the 1 minute ritual with sitting posture and breathing patterns so the effect holds steady over many weeks. Freedom in the bedroom doesn't come from doing more, but from understanding more deeply. The 1 minute ritual does not replace medical advice. It's a small match struck in a room that's been dark for too long, so you can see your own safe path. If today you feel a notch lighter, subscribe so you don't miss the next part. Leave a 1 if you're ready to try 7 nights in a row. Leave a 0 if you're still stuck, and say exactly where the snag is. I'll refine the guidance to fit more closely. I'm Dr. Emily Carter, a urologist in Austin, Texas. Men's Health Secrets. We don't ask the body to go back to 20. We only ask for a warm, steady flow, enough for 2 people to stay with each other longer, calmer, and more confident.